All right. Hello. My name is Nikki, and we are going to read through the Code of Ethics. There are 11 of them, and if someone wants to start off here, and we're going to go through all of them, and then we'll discuss which ones we think are important to us.
I'll start with the first one. So the first is the registered technologist acts in a professional manner, responds to patient needs, and supports colleagues and associates in providing quality patient care. The second one is the registered technologist acts to advance the principal objective of the profession to provide services to humanity with full respect for the dignity of humankind.
And then I'll read the next two. Number three is the registered technologist delivers patient care and service unrestricted by the concerns of personal attributes or the nature of the disease or illness and without discrimination on the basis of race, color, creed, religion, national origin, sex, marital status, status with regard to public assistance, familial status, disability, sexual orientation, gender identity, veteran status, age, or any other legally protected basis. Number four is the registered technologist practices technology founded upon theoretical knowledge and concepts, uses equipment and accessories consistent with the purposes for which they were designed, and employs procedures and techniques appropriately.
Okay. Number five, the registered technologist assesses situations, exercise care, discretion, and judgment, assumes responsibility for professional decisions, and acts in the best interest of the patient. Number six, the registered technologist acts, acts as an agent through observation and communication to obtain pertinent information for the physician, to aid in the diagnosis and the treatment of the patient, and recognizes the interpretation and diagnosis are outside the scope of practice for the profession.
I'll read the next one. Number seven is the registered technologist uses equipment and accessories, employees, techniques, and procedures, performs services in accordance with an accepted standard of practice, and demonstrates expertise in minimizing radiology or radiation exposure to the patient, self, and other members of the healthcare team. Number eight is registered technologist practices ethical conduct appropriate to the profession and protects the patient's right to quality radiologic technology care.
And number nine is the registered technologist respects confidences entrusted in the course of professional practice, respects the patient's right to privacy, and reveals confidential information only as required by law or to protect the welfare of the individual or the community. The registered technologist continually strives to improve knowledge and skills by participating in continuing education and professional activities, sharing knowledge with colleagues, and investigating new aspects of professional practice. And the last one, number 11, is the registered technologist refrains from the use of illegal drugs and/or any legally controlled substances which result in the impairment of professional judgment and/or the ability to practice radiological technology with reasonable skill and safety to patients. Right. And then if we want to talk about like which ones we feel are the most important to us and why.
I can go first if
Okay, sure.
so there's two that I found important. Number three for me was one important. I think it's important because I don't believe that anything should impair you to do your job. It's our job to help any patient, regardless of any identity, sex, belief. We don't get to pick who we help. And I think we also take an oath as radiologists to help any patients, regardless of any status of anything. And I think it's also important that it is emphasized in the ethics code because I think sometimes we can be biased. And if we didn't have this as a code, maybe our healthcare system would probably fail and we would only help who we wanted to help, and maybe others would fall down the cracks there. And I also truly believe in this ethics, the morals. It's one of the reasons why I did pursue a career in the healthcare field, to help anybody regardless of any status or belief. Another one that I did think was important to me as well was number 6. I think it's important because I believe that it's crucial as a radiologist to understand our limitations and the boundary between a radiologist and a physician. It's our duty to perform the scans that are coming in, the orders that are coming in, but it's not in our job description to diagnose a study or inform a patient of something that we may think, we may analyze it, and we may understand probably there's something going on there, but it's not under our job description to make the aware patient or to alert them and maybe instill more fear because a lot of the patients are coming in for these tests with fears already of maybe they have a tumor or there's a possibility that they're freaking out about a situation. And we could also be wrong about the diagnosis. So I think it is important that we acknowledge and understand that there is a boundary between a radiologist and a physician.
Anyone have anything to add to that what Patty said, or no?
I want to agree with the saying that it is out of our scope of practice for us to be telling our diagnosis to the patient. That's the doctors. They're trained. That's why they have so many years of studies, going to 4 or 5, I don't know how many years to practice on that. So I agree.
Yeah, I agree with what both you guys said on number 6. Especially going into the field, it's like, what are you allowed to say and what are you not allowed to say? So I like how it's perfectly stated in like the ethics code that you cannot give any information about what you're seeing until the doctor reviews it and then they'll be the one presenting it. So it's very, I'm glad that one's like one of the most important ones for that you went over because it's very important for us to also realize like we just take the image and then send it to the doctor. So it's very
I think
important.
it's also important for us to kind of be aware that our facial expressions can also say a lot. So I think
Yeah.
we kind of have to maintain that boundary as well, like not be sad if we see an image because we might have seen anything, because that can also instill for a patient, be like, oh, well, the radiologist looked this type of way after they took the scan.
Mm-hmm. Yeah.
Yeah. We have to be like aware of our actions and slip ups.
Yes.
Mm-hmm.
Yeah, I like that you brought that up because I feel like a lot of people, when they go into anything, they kind of read into the expressions of others. So I think, I like that you brought that up because I think facial expressions do say a lot more than
Mm-hmm.
we think.
Yeah.
Yeah.
Let's see. So, which one? Does someone else want to talk about which one they felt was most important?
I can go. Yeah. So I agree with Patty on number 3, regarding that as a radiology, as a registered technologist, that we deliver patient care no matter anything, any status, any like image, illness, that we still do our job and help whoever we can, especially with things evolving as we progress throughout all of life. It's like there's a lot of new things that we're seeing. And so that was one of the most important ones that we still deliver the utmost care to anyone that walks in the door or anyone we see at a clinic or hospital. Especially like diseases is a big one that like I feel like is a big thing, especially just to protect ourselves and that we also protect the person that we're seeing and make sure that they're comfortable with whatever we're doing and make sure that everyone we see is just equal. And that's what I love about how it's like reading is that we maintain care to everyone we see no matter anything, which I love about that they state. And then the second one was number 7, just explaining that we, as a radiology technologist, are able to demonstrate and minimize radiation exposure to patients and ourselves and anyone around us, and even perform the standard practice of what they teach us in the ARRT or whoever we're like in clinicals with. So I like how those two are stated, that we maintain a certain standard of care using equipment, procedures, and even radiation exposure, and make sure it's low as possible for anyone we see.
And to add to your number three, I think it's also important because I worked as a insurance in the insurance department for a radiologist office, and I wasn't aware, but just comes to show that I mean you could actually treat anybody regardless. But there would be patients that were in jail, and you still have to treat them. You don't get to question like, oh, I'm not going to help them because they might have committed a murder or etc. Whatever they might have done. We don't get to question that. They come in with the officers help you, and you just do your job. So it comes into show that it is truly anybody, regardless of anything.
Yeah, I think most hospitals and stuff have a zero tolerance for a lot of stuff. So if you're refusing to treat someone, you're probably not going to have a job for very much longer, you know. So and then you probably got into the wrong field if you don't want to help everyone because
Mhm.
it shouldn't matter. Um, on that, I chose that number six was the most important to me. Acts through observation and communication to, that's not the one I picked. Sorry. I picked number five. Assesses situations, exercises care, discretion, judgment, and acts in the best interest of the patient. Um, which made me, I looked up the definition of healthcare, and it's the organized provision of medical care to individuals or a community. I got into the healthcare field because I like to help people, and I can't, I just, yeah, it's the best interest of the patient. So what are we doing for the best interest of the patient? I always have the patient as a mostly as a priority. Obviously, you want to make sure you're safe and your coworkers, but I just felt like that was the key wording for me was the best interest of the patient. So that one I felt was important to me.
Yeah, and I think it's important because it also comes into play to advocate for your patient, which is also included in acting for the best interest of the patient. I think that's important too, that we remember that we do have to advocate for our patients. Some patients may not be able to, maybe they don't understand or they don't understand the language. I think it's important that we are also aware that there's some things that we need to make sure that we teach them and make sure that they're doing their choice for any procedure, or if they're not feeling comfortable with something, that we instill that for a patient.
Yeah, and that one especially states that it's in the best interest of the patient. And majority of them are like talking about you as the radiology technologist or staff. And it's like that one really stands out as like as a registered technologist, like what is the best interest for the patient. So that one's really important as well.
Yes, I could also agree. I work as a CNA, so you kind of there's some patients where they don't have a voice or they're not able to like speak up. You kind of have to provide the best care that you can for them.
Uh,
Yeah,
yeah, sorry.
I agree with all of you. I think it's important to like take the best interests of the patient, and I think it goes along with one of my top ones, which was number two, to treat everyone with humanity and full respect, because at the end of the day, we are treating patients who are real humans and with real emotions, so it really matters. A lot of them don't want to be there or they're really scared, so they're really vulnerable and just in a state that not most of us are comfortable with. So it's important that we do every procedure with the most respect and compassion as we can for each person. And also, one of my other ones was number 10, which was the continuing education, especially in healthcare, since new things are always developing, and especially new technology, which we use a lot of like different machines and stuff. So it's important to be up to date so that we can provide the best and safe care possible, since our education doesn't just stop at a like certificate or a license. It keeps going for life pretty much.
Yeah.
Yeah.
All right. I think Natalia, did you talk about which one was the most important to you?
So, as I chose number 3, and um, reasons more. All of them are important, but I think that one that stood out for me was 3, because during what we're dealing right now with racism, discrimination against minorities. So, as a healthcare worker, you shouldn't be able to deny the care of that person. Everyone has rights for human it's human rights to have a healthcare. So I thought that was very important. It, it if you like do misconduct, or it could cost you your loss of license, or potentially revoke, suspend you. So I think that was very important. And it just brought me a story, a case that I remember, or it happened just recently about a nurse, a registered nurse in Simi Valley, that she's being charged for battery assault because she assaulted this Mexican street vendor. So I mean, respect others as you want to be respected. Um, she is facing charges, and she's being investigated by the the nursing registry, and potentially she could lose her licensing. So I think that's one of the important things to follow. And I also thought number 6 is important. Um, it is not our job, or our we're not trained to diagnose the patient, tell them what they have. Even if you know what it is from experience or seeing multiple images, just keep that to yourself. You don't want to cause fear, because it could be something else, and you don't want to be in trouble.
Yeah, I
Mhm.
think that's true. It also goes back to what Kaylee said for number 2 and what you kind of said. Patients are already coming. They're not happy about coming to us. So we don't know what they're going through. Like, we don't want them there, right? We don't want to be delivering any news that we also aren't sure of. And if we're instilling that fear or making a gesture or made a comment that was unnecessary, that could cause the patient to freak out, possibly not contact their doctor for the actual results because one of us might have said something that we shouldn't have. So I think that's also important to make sure that we're not instilling more fear to them.
Yeah, I agree with what majority of you guys said on like number 3, number 2. It's like my parents both told me like people are coming in either on their worst of days, or they're coming in on just times of their life where they don't want to be talked to about certain situations that they could be in, or medical situations. So my mom and my dad both were like, you are like the one person they see throughout their whole day. Just like try to like just be happy, smile, make sure you're kind, and then when they go to the doctor, that's all you can do. So yeah, just have a little bit of kindness for people going through probably one of the toughest things they're going through, or even with the way the world is right now, especially just have kindness. And I think that's probably the most important thing we're going to learn throughout our clinicals and throughout our training.
Yeah, for sure.
Yeah,
Being compassion.
Yeah.
yeah,
Yes.
compassion, patience.
Yeah. And a lot of empathy, I'm assuming.
Mhm.
Yeah.
All right. Well, does anyone else have any closing comments to say think we covered it.
I
I'm
think
going to stop
think so.
recording.